So you've been involved in, I think, two very exciting aspects of immunotherapy here at Moffitt. The first is the use of the P53 vaccine, and the second is the development of the PD-1 therapy. Can you tell us a little bit more detail about the work you've done with the P53 vaccine for small cell lung cancer, and then afterwards talk about the PD-1 therapies and the excitement that this has brought?
Yeah, so we have developed a number of different vaccines. One that Dr. Howard just mentioned, and that is the P53 vaccine. That is a personalized vaccine, a vaccine that we manufacture from cells from the blood of every individual patient. So we make individual vaccines for each patient. And these vaccines are what we call gene-modified cell-based vaccines. So we use a form of gene therapy to modify important cells of the immune system whose role is to turn on immune responses. We call them dendritic cells. And we modify them through this gene therapy techniques in such a way that they then turn on the immune system so that the lymphocytes are reactive to this protein that is abnormally expressed in 90% of small cell lung cancers, and it's P53. We first tested that in phase 1 and phase 2 trials, and it looked promising. Now, the vaccine itself actually produced responses, meaning shrunk people's cancers about 5% of the time. But really what is much more exciting, because 5% isn't good enough for us, but what is much more exciting is we've discovered that people who get chemotherapy after the vaccine respond far more frequently than they would if they didn't get the vaccine. And so there's this synergy between chemotherapy given after the vaccine with the vaccine. We also have in development here as well a vaccine for patients who have lung adenocarcinoma, so a non-small cell lung cancer. And similarly, it is a gene-modified cell-based vaccine. But here, the cells are not from the patients themselves, and so it is more of an off-the-shelf or out-of-the-freezer vaccine. It doesn't need to be manufactured for each individual patient. And this is looking very exciting for non-small cell lung cancer. So really, it's the first time where there's been convincing evidence now that you can use an immunotherapy in lung cancer and produce very significant results.